Hello students, welcome into a video lecture. This time we're going to be talking about middle adulthood and some of the changes that happen specifically with fertility and the reproductive system, for example. So we're going to talk about what's known as the climacteric and look at the perspectives of females and also males. A lot of people often associate it with females only, but obviously with men we see some changes as well. All right, so let's get into it here as we bring up the slides. So we go to something called the climacteric, okay? Obviously it's going to include things like menopause, impotence in men as an example, so a lot of different things we're going to talk about here. Okay, so let's define climacteric, which is kind of confusing. It's referring to abrupt changes in the body by hormonal balance changes. In other words, this is sort of an umbrella term that covers many different things, not just specifically menopause, but that would be included, of course. In other words, the way to kind of think about it, it's sort of a midlife transition that's associated with declines in our ability to be fertile and to reproduce and things like that. So it's often centered around those sort of issues. So of course, what immediately comes to mind for most of us is probably menopause. So let's talk about that. So in this case, obviously, we're talking about women. Technically, what that means is a cessation of menstruation. And what we're finding is that it tends to vary from person to person. Everyone, every woman kind of experiences it a little bit different. And we see different symptoms and variations in symptoms. Even cultural factors seem to play a part in this, okay? So for most women, if we averaged all the findings here, the typical age is around 51 or so, but remember there's lots of variations in that. There's some women that may have it in their 40s. Sometimes it's a little bit later, but once again, if we average all that out, about 51 or so. And so this would be a transitory sort of time for women where they may experience their last periods as an example. So it's often thought to be a transitional phase, which in some cases can last up to a decade in length. So a lot of people think it's maybe like a year. It seems to be kind of spread out over time where we see a beginning phase, an after phase and things like that. So some people can last up to a decade. During this time, women experience drops in hormones such as estrogen and progesterone, okay? And so this is due to the ovaries failing to produce those particular hormones, which leads to various physical symptoms. Now, there's a lot of symptoms. I'm just going to list them off here. Keep in mind that they do vary from person to person. So some of these symptoms would include things like stomach aches, hot flashes, which is one of the most widely known physical symptom, exhaustion, mood swings would be another one, weight gain. So some women gain weight during this time. Problems with sex, so sexual difficulties, and even something called the night sweats, which obviously could be related to the hot flashes as well. Okay, so those are our basic symptoms. Now we're going to look at how people react a little bit differently to the symptoms, because we do see some changes in that and some differences. So we go to different reactions to menopause. So not every single woman reacts the same way to these changes that are occurring in their body. And the difference in reactions seem to relate to a whole host of different factors, which we're going to look at. Okay, so let's look at these factors. And there's a few here. So attitudes towards sexuality, lifestyle, function within the family, and hormone levels. Let's take a look at each one of those. So attitudes towards sex. A lot of times menopause is accompanied by problems having sex, more specifically lubrication for the woman, which obviously can be uncomfortable and even painful. So the point I think here is that if you're a really strong sexual person, like your libido is on overdrive, and these changes are creating difficulties in that experience, you can see why that would be a huge bummer for someone compared to someone who doesn't really care and is not very sexually active. Lifestyle seems to matter, so lifestyle factors. Obviously, these symptoms can hinder your lifestyle. For example, if you're having to deal with hot flashes. So if you're someone that's really on the go and You don't want to be held back by symptoms. You can see how this could create a negative feeling in that person that these symptoms may be hindering them. Function within the family. You know, for example, if one of your roles in life is to be a mother figure and to have children, knowing that your reproductive cycle is now ending, or your ability to have children is coming to an end, that could be a huge negative factor for some women who've devoted their life to that, and realizing that the possibility of that is taken, you can see how that could be a negative thing. All right, and then hormone levels. So I think what we mean here is that lower levels cause bigger changes. In other words, when those levels really drop, these symptoms become more hardcore. And so if that was the case, then your reaction would probably be more likely on the negative end of that, because now you're having to deal with more severe symptoms compared to if the hormone levels didn't drop as severely. So that would obviously factor in. We see some cross-cultural differences as well. So for example, according to our studies given in the textbook, Asian women report having fewer hot flashes when compared to Western women. Now, is that due to a cultural factor or diet or different beliefs and treatments? You know, that's hard to say, but we do see some consistent findings in that. So there are some cultural variations. It's surprising to know that a lot of women simply do not understand what's happening or not fully informed of the facts surrounding menopause. So that's great that you're taking a class like this so you can be informed. So it's a surprising number of women are simply uninformed about menopause, which obviously could be distressing when you're not prepared for this psychologically, for these changes that are coming or are happening in your body. So it's interesting how a lot of women are simply not informed about the changes. So obviously you want to have a discussion with your doctor in terms of what to expect and what you can do in terms of treating it and so forth. So very important conversation to have with your doctor when the time comes. We know that menopause can be coupled with negative feelings. I mean, that's pretty obvious, but some of them would surround the fear of growing old. I mean, that's a huge sign that you're not quite young anymore. You're going through these changes, and that can bother people, as you can imagine. Realizing the end of your reproductive period, as we said before, that can be a huge bummer, and people could really react strongly to that, okay? Also keep in mind that if menopause happens later than average, it is linked to a higher risk of breast cancer. So I guess the point there is that knowing that it does come with some health risks depending on the circumstances, that could be a huge psychological shock, which could be negative in nature. Well, let's not be Debbie Downers here. Research does reveal that it can be a relief for some women. So I liked how we can take the positive spin on that. Number one, you never have to worry about getting pregnant again, right? So no more birth control and taking measures to prevent pregnancy. So in other words, you can now be sexually active and not have to worry about that, having another child, that kind of thing, if that was on your mind. No more periods, right? So some women have really heavy periods, and so not having to deal with that anymore obviously would be a huge relief if you're in that scenario. So once again, we're finding that menopause comes with some pluses and minuses depending on how you look at it there. All right, so our treatment, there's a lot of different treatments, but one of the most famous ones is HRT, hormone replacement therapy, which by the way is a little bit controversial because it does come with some health dangers, which we're going to discuss. Basically, these hormones are given at low levels for short periods of time to alleviate the unpleasant symptoms of menopause, more specifically estrogen and progestin. So in other words, the therapy is replacing or replenishing the dropping hormone levels. These are used in the short term and actually may reduce other health dangers, including heart disease, certain types of cancer, and osteoporosis, which is linked to bone fractures and things like that. So not only does it alleviate the symptoms, there's some evidence that it could prevent some of those issues from occurring. However, Some studies are showing that it does come with some risks and some health dangers. For example, some studies may show it actually may increase the risk of heart disease, stroke, is associated with breast cancer and blood clots, which obviously are not pleasant things and can be a little bit scary. So what the research is basically showing is that these health dangers seem to be more of a factor for older women. So if you went through menopause a little bit later than average, the risk factors would go up. So that's something you would need to think about if you were considering the treatment. Very important to have a discussion with your doctor to weigh your options. For example, how severe your symptoms are, and then the risk factors for these health dangers, okay? We also know that things like history of disease in the family and the degree of symptoms also kind of factor into that decision. So you want to look at your age. Do you have a family history of these problems? How severe are your symptoms? And I would weigh those factors. If I was a menopausal woman, kind of weird to think about, but certainly you would have to consider that and talk about that with your doctor, okay? Other treatments for menopause, there's a lot of them. So those include things like exercise, certain diet supplements, so that's been proven to be effective, herbal remedies as well, acupuncture, and even relaxation therapy, and that's not even the entire list. So the point is that even though this is probably our most common one, depending on where you live and where your culture and things like that, there's other treatment options out there. All right, so now we're going to talk about the male climacteric. It seems like all the focus goes on women with menopause, but obviously men, we do experience changes as well. Some people kind of jokingly refer to this as male menopause. I love that. But more specifically, we refer to it as the male change of life. In other words, it's sort of all related here. Men experience a decline in sexual potency during this stage. In other words, this is associated with erectile dysfunction or the ability to maintain an erection. Okay, and so we see that that's more likely to happen when you get older, to have problems in that area. Okay, and so a lot of men report that they need more stimulation to kind of keep things going, if you know what I mean. This is also connected to lifestyle factors and disease. So for example, smoking is connected to impotency, diabetes, being obese, having hypertension, as well as having high cholesterol levels have all been connected through research to impotency. The good news is there's lots of solutions for that. And we'll cover that a little bit later in the class, but there are solutions to this problem. Some research also shows that our sperm count does drop, but not significantly. So what's amazing about this is that men can still father children into their 90s. We have cases of that, if you can imagine that. So a lot of difference between men and women here is that men can still produce children, even in old age, as we're finding. Okay, some other changes. Testosterone, which is related to this, testosterone production decreases gradually. Usually this is in your 50s and 60s is when this happens, but that does slowly decline. So as a result of that, you may produce fewer viable sperm. The testes will change, including your prostate gland as well. However, our hormones and our sexual desire do not drop as fast as women. So that's another difference. You may not lose your libido as fast as women do, and the hormones do not drop as suddenly as they do with menopause. So there's some different changes with that. Other changes. Something called the refractory period lengthens. So some of you may not know what that is. That is the time in between a male's orgasm. In other words, let's say that he's reached an orgasm. There's a little time period in there before he's ready to go again, if you know what I mean. And so as we get older, that time frame actually expands, and thus men would need more of a recovery time to be ready to go again. So that's kind of what we're referring to there. All right, so the treatment a lot of times is testosterone replacement therapy, which has been proven to be connected to a lot of benefits, as it turns out. So not only include in sexual not only does it include sexual functioning improvements, it also improves muscle strength, your bone health, as it turns out, and it lowers your risk of heart attack and stroke. So wow, so the testosterone replacement therapy, as the studies are kind of coming in, are showing lots of benefits for men as they're dealing with these problems. So that's kind of encouraging there. All right, so that will conclude our short lecture on the climacteric from a female and male perspective. Please move on to the next step in the class, and we will see you online.